Hi, I'm Billy Walker, and today I'm going to be showing you how to perform a physical exam on a cow. Before we get started, I'd like to give a special thanks to Dr. Paige Schwartz from Michigan State University for providing me with this checkoff sheet, as well as Zane Trotter for providing me with the facilities, as well as letting me use his cows. Go ahead and take a look at the sheet here. This is what you need to fill out while performing the exam. So we'll go ahead and get started and fill that out. First things first, you want to take a step back, take a look at your cow, and identify what you have. This here is a Maine Anjou cow. She's about 3 years old. Hopefully she's bred. She hasn't been palpated yet, but when she does, hopefully she is bred. Next thing, you want to give a body conditioning score. That goes from 1 to 5, 1 being the poorest, 5 being the best. You want to look at her. Muscled up, and she's not too skinny. She is pretty fat, so I give her a body conditioning score of about 4, which is pretty good. Next, you want to look at her behavior, see how she's acting. She's pretty calm, not acting up, so that's a good sign. Then you want to step up here in the front, look at her appearance, take a look at her head, look at her directly in the front at her head, make sure it's good and symmetrical, which it is. Looks pretty good. You want to step in here, get a little closer, take a look at her eyes, make sure they're not cloudy or any cataracts, anything like that. They do look pretty good. You also want to look at the mucous membranes, make sure she does have a little bit of little fluid in there, and they are discharging just a little bit of fluid. They look good. You also want to get down here and look at her nares, make sure she does have good airflow coming out of both of them, which she does. Also, you want to take a look at the thorax region as well as the abdomen, which is right in here. And while you're here, you can take the heart rate, the respiratory rate. You step back here on the left side where the rumen is, and take your rumination rate. So we'll go ahead and get started doing that. First off, we'll check our heart rate. Get the timer. The average heart rate is about 48 to 84 beats a minute. Hers is pretty good, coming in about 60 beats a minute. Next, you want to step in, like I said, and do the respiratory rate. The approximate respiratory rate is 26 to 50 breaths per minute, so we'll go ahead and check that. Alright, she had a respiratory rate of about 35 breaths a minute, so that is pretty good. Last thing, you check back here in the abdomen, the rumen. She should have between 1 to 3 flushes per minute, and if you listen real close, it sounds like a toilet flushing. So we go ahead and check it out. Get here and press real hard where you can hear it. She does have about 3 contractions per minute, so she is good up there. You can also step back here and take the temperature. Average temperature is 98 to 102.4 degrees. To get my thermometer here, raise up the tail, stick it in the rectum just a bit. Alrighty. The temperature of about 101.5, so she does fall within range. She is pretty good there. Also, you want to step up here and check her capillary refill time. It should not be greater than 2 seconds. So what you want to do is grab her here, raise up her lip, and press on her gums there. Does look pretty good, so that's good. Also, you want to check the lymph nodes. You have your prescapular, your prefemoral, as well as your submandibular that we're going to check. Starting with your prescapular, it's going to be right here, cranial to the point of the scapula. So you feel in here, it should be round, cylindrical, about the size of a marker. There it is there. You want to check, make sure it's not swollen or anything like that. That one does feel good. We step back here to the prefemoral, which is cranial to the stifle, and it's distal and cranial to the part of the femur. There it is there. That's pretty good. And last thing, we'll go up here and check the submandibular. Just right here. Once again, you want to make sure it's not swollen or enlarged or anything like that. And it does feel pretty good. And that there is your basic exam on a cow. She does look basically perfect, pretty healthy. And that there concludes my video. Thank you.